Numerous COVID-19 restrictions returned this week as the Omicron variant continues to fuel record case counts. For her thoughts on the local impact, we're joined by Dr. Janet DeMille. She's the Medical Officer of Health for the Thunder Bay District. Good morning, Dr. DeMille.
Good morning, Sean.
So what is your sense of how prevalent the virus is in our community at this point?
So I think that it is fairly prevalent. I think, we're seeing numbers in terms of the numbers that we get that are really much higher than what we've seen in the past, any time in this pandemic. We know that we've seen this virus and confirmed cases in all areas of the Thunder Bay District and certainly in First Nation communities as well. So we see that it's very widespread, and the numbers indicating that we're really at a fairly sort of high number. And I estimate that there might be, about 4 times as many as what we report. That's on, ballpark in my head when I see what we're reporting every day. It could be as high as four times that we actually see. So it's out there for sure.
Now, as of yesterday, 15 people were in the Thunder Bay Hospital with COVID-19. What message do you want people to take from that? So,
I think this is a virus that does cause people to require hospitalization, right? And, we've seen this throughout the course of the pandemic. I would say overall, when we look at hospitalization numbers, and I think the 15 is the Thunder Bay Regional Health Sciences Center number, which they can have people from anywhere in northwestern Ontario. But I would say overall, the number of hospitalizations, given the overall number of cases that I think we have, is actually really good. I think if this were, and I think this is probably due to Omicron, which we know and the evidence is showing that overall people are less likely, if they are infected with Omicron variant, to have those severe consequences or the serious outcomes where they require hospitalization. So I think overall that is good news. However, it is important to, people do require hospitalization, and if we see our numbers continue to go up, which I'm expecting they will, we could see hospitalization numbers go up as well. And these are, individuals with families, and I know that could be quite hard on them.
I mean, so what is your takeaway then about the current hospital situation here in, I guess, northwestern Ontario, but more specifically Thunder Bay? There are examples in other parts of the province where hospitals are becoming completely overwhelmed to the point of closure. I know specifically in the Niagara region, we closed one of the hospitals there and relocated staff to other hospitals. Do you have the concerns about that on our system?
So I'm in communication with the Thunder Bay Regional so that I know what their situation is and the pressures that they're feeling. And, I think they're doing, as I understand it, okay right now in terms of that, although I do know that they have very solid surge plans to be able to deal with higher numbers, whether it's in the general hospital floors or in the ICU, and of course potentially need it, in the emergency room. So, as I understand it, things are okay. At the same time, I know that here in the Thunder Bay District, we have, overall our numbers appear to be lower at this time than the rest of the province. So we might be behind other health units like the Niagara area or other areas down south. So I would anticipate that if our numbers, and again, I am anticipating our numbers to go up, that we will see more hospitalization, and that will put increased pressure on the hospital here in Thunder Bay as well as, hospitals in the district and healthcare overall. So I think it is, a reminder why we still have to kind of control the spread of the virus. We want to make sure that we don't have a huge spike of people getting infected all at the same time, so that we can spread out, the pressure potentially on the healthcare system, which is the way I interpret the decisions that the province made on Monday was, the implementation of additional measures to slow down, in a sense, the spread of Omicron in communities. And take some of the anticipated pressure off the health system.
Now, the eligibility rules for PCR tests have changed. What impact is that having on your ability to track the virus?
Yeah. So it has a very significant ability in terms of us knowing really what's going on and where it's happening, right? You talked about just now, daycares, right, on the news and other areas. There's the eligibility wouldn't include certain people, and therefore we wouldn't necessarily know when there's a case in a particular setting, and then sort of follow up with that setting. I think, and as well, our numbers, as we've already talked about, we really don't know how many, cases we actually have in our area, because we only get the ones that have the PCR test. So, and that's obviously a substantial change of where things were from over a week ago. And, I think it is still evolving. This is interim guidance that we have on for a lot of this in terms of the Omicron surge. And I think we're going to see more potentially on the PCR testing side, but also even on the rapid antigen testing, and perhaps more availability of that, which is another way of being able to monitor what's happening.
Now, last week it was announced that Ontario was going to stop collecting COVID-19 numbers from school boards and suspend reporting of cases in schools themselves. Based on that, would you say schools are a safe place for our children to be, not knowing the effects of COVID-19 and the Omicron variant?
So that is a really big question, and I think an important question. If I'll just step back, and I think that we have, I think there's a lot of, in terms of Omicron, it's overall a milder illness where they're, less likely to have those serious outcomes, as we just talked about. And we also know that the vaccine is very protective against people getting really sick. It's not that people won't get sick, but, they'll be able to mostly manage at home. And some people, quite frankly, are going to have very little, if any, symptoms. So overall, we have a virus, a respiratory virus, that is milder. And the question then becomes, how much work do we need to do in certain settings, or including the monitoring, to really manage what's happening? And when we talk about, when I think of schools and, elementary and secondary, I think we need to realize the significant consequences of when schools are closed, and that the consequences of schools being closed to in-person learning are, in my opinion and the opinion of many others, vastly more than the consequences of the Omicron in those settings, and that there is harms that are happening to students when schools are closed to in-person learning. And so I think what we need to do, and so when we talk about safe and what is safe, I think in many ways, for many, many students, the best place for them to be is in school and learning in person. And I think what we're going to see, over the next couple of weeks is sort of an evolution of our approach to schools. We're still actually waiting on the direction in terms of how to support schools if there is Omicron and if potentially spreads. I do think there can be approaches that are less intensive and less invasive in sense of what we were doing back in November and December related to the Delta variant. So, I think there's a lot of, opportunity and perhaps some hope that we can better live with COVID. while at the same time maintaining some measures to find the right balance in terms of managing Omicron, but still allowing people to do the things that they need to do, including having students go to school.
So how effective then would you say is the kids going online? Because today is their first official day returning back to school in an online capacity. Do you think that's an effective tool to help mitigate the spread of COVID-19, or would you suggest another method then?
So, I mean, obviously when you don't have a large group of kids together in a school setting, interacting with one another, then that can be a way of mitigating the spread, and certainly people are at home, and if they're not sort of interacting with others. I think what we've always seen is that kids were actually, in many ways, more likely to get COVID outside of the school than within the school. That's their interactions that they have in other things that they do outside where we're spreading the virus, and then that would potentially introduce it into the schools. So I think while online, going online and having kids at home and not interacting with one another, can reduce the spread in some ways. You can still see cases in kids if they're still interacting with others. And again, there's other consequences that we're not measuring and that we're not always considering, again, when kids are not in school learning.
No, I just want to bring it back to the metrics for a second. People are questioning whether or not case counts are still useful metrics. You mentioned that reported cases could be as much as 4 times as high as being what is being reported. Yesterday, we spoke to an expert, and I do apologize because his name is slipping my memory right now, but he quoted at 3 to 4 times as well. Yeah. So what should the average citizen be looking out for when trying to assess the situation here in northwestern Ontario?
Yeah. You know what, I think that we need to realize, and I've said this before in the pandemic, that COVID-19 is really tricky, and it is going to seemingly appear out of the blue, and I think people need to just assume that it could be anywhere they are, and whether, for those that are going to work, the Omicron could be there, and it could be in somebody who's not aware that they have it. It could be in somebody who maybe has a mild symptom, and who's at work, but maybe they don't even have symptoms because we know that it can spread before somebody develops symptoms. So we all have to act that when we go, if we go to work in person, if we go to the grocery store, if we go, to the mall, wherever we go, that somebody there that you could be interacting with could have COVID, and that could transmit. And so it's all of those measures that we know. So first of all, if you have any symptoms, please stay home. Follow the guidance on, on our website or on the Ontario website. I think it's ontario.ca/exposed or something. There's the guidance is there. But stay home. Don't go out if you have any symptoms because you could have COVID and it could spread. Wear a mask. Maintain physical distancing where you can. And wash your hands and avoid sort of interacting with too many people, like especially those close interactions. Limit your overall gathering with one another, and all of those measures, and just assuming that COVID-19 could be anywhere, and taking all of those measures will help us collectively control the spread of COVID-19, and certainly help get schools open and help our workplaces and businesses stay open as well. And if we can control COVID-19, we will be able to reduce those other restrictions that were also imposed.
Dr. DeMille, thank you for joining us today.
Thank you again, Sean.